It will travel through the state on April 8th. As you may know, many Ohioans will have a front seat for a total eclipse. All or part of 55 counties are in the path of totality, while those in our other 33 counties will also enjoy at least a partial eclipse to view. And this is a very exciting event for our state and for many of us, truly a once-in-a-lifetime opportunity. At the Ohio Department of Health, our main concern is with eye safety. I want to caution all Ohioans that it is never safe to look directly at the sun, even during the brief period of totality, which, depending on where you are, could be a matter of 2 to 4 minutes. The moon blocking the sun can move ever so slightly, and even a quick change and a quick glimpse during that can cause immediate and permanent damage to your eyes. The good news is there are safe ways to view the eclipse. One way is to ensure that any eclipse glasses that you may have acquired or are going to acquire have the approved safety standard marked right on the eyewear. And what you should look for is the ISO 12312-2 marking. I'll repeat that. That's ISO 12312-2. This is very important. Sunglasses are not safe eclipse viewing eyewear, nor are cameras, binoculars, or telescopes. We have information on safe eclipse viewing on our Ohio Department of Health website, and we will share that link in the chat right now. It includes links to several organizations that have compiled lists of where you can find approved eclipse glasses. Another safe option for watching the eclipse that some of us might enjoy is by visiting NASA's website. The agency plans to live stream the eclipse, and viewing it on your computer or another device will not harm your eyes. For much more information on eye safety during the eclipse, I want to turn now to our guest. Dr. Jeffrey Walline is the acting dean at the Ohio State University College of Optometry. Dr. Walline, welcome. I know many of us have heard or were told when maybe we were younger, never to look directly at the sun. And that warning is particularly important during this eclipse. Can you explain exactly what is so dangerous about looking at the sun and what specifically doing so can do to our eyes?
Sure, and I think you hinted at the importance of not looking at the sun on any day. The difference between a day with an eclipse and every other day is just that we are more likely to look at the sun during the eclipse, but we should never look directly at the sun. The damage that it can cause is similar to a sunburn on your skin. So just a few hours or minutes even in the sun can burn your skin. It can also burn the back of your eye, the seeing part called the retina. But there's a couple of important differences between the retina and the skin on your shoulder or on your arms. First of all, the skin on your shoulder or your arms can heal, and it heals relatively quickly. But the retina in the back of your eye cannot heal, so you can actually lose vision permanently. The other significant difference between the retina and the skin is that a sunburn happens on the skin over a period of minutes to hours, whereas on the eye, just like you said, it happens over a period of seconds to minutes. So even just a few brief looks at the sun can cause permanent damage to our vision. And so those are the important things to keep in mind, is that while it's similar to what happens to our skin, there are a lot of very important differences, and our vision is really important to protect.
Yeah, thank you, Dr. Walline. You know, I talked about the importance of safe eyewear, making sure it has the specified ISO rating that I noted. And I talked about the option of watching the eclipse on NASA feed on an electronic device. Are there other safe options that people can avail themselves of, or other recommendations you would make regarding viewing of this extraordinary event?
Yeah, I think it's an important question. And really, I would say there is one other option for safely viewing it, and that is a pinhole aperture, something that you probably did in elementary school, where you just you can actually create it yourself very easily. There's instructions on the internet everywhere. Just simply have two pieces of cardboard, cut about a 1 inch hole out of one of those pieces of cardboard, put some aluminum foil over that, and then put a pinprick in it. Hold that one closest to the sun, hold the other one as far away from it as you can. It'll give you an image of the sun on the cardboard, and then you'll see the moon passing over it. So that's one way to safely view it. Other than that, there really aren't any other safe ways to view it. So I'll tell you, sunglasses don't help. You shouldn't ever stare at the sun, even with sunglasses. You should not use cameras to view the sun. Certainly should not use binoculars to view the sun. Sometimes they can even concentrate the rays that will burn your eyes. So really the only safe ways, I think, are the safety glasses. And you want to make sure that they're current. They're not the ones from the last eclipse, and that they're obtained from a source that you trust.
Thank you. We've referenced that we have information on our Ohio Department of Health website, but what other resources are available if people want to learn more about eye health and eye safety during the eclipse?
Yeah, the College of Optometry has some education that was actually provided to our optometrists so that they could teach their patients as well as the media about the importance of taking care of the eyes. And that goes a little bit more in depth into how the eyes are damaged. So that if people want that information, it's available. But also, like you list, important information about where you can purchase glasses from. And that can be found at optometry.osu.edu/eclipse. And then the Ohio Optometric Association, if you just Google the Ohio Optometric Association, right on their front page, you can see a link to their information about the eclipse. And I think those are two important sources, as well as the Astrological Association, that I think provides great information. And like you said, NASA.
Super. Thank you so much for joining us, Dr. Walline.